The House will please come to order. Good morning, colleagues. Welcome to the 14th day, the 66th Wyoming Legislature, Thursday, March 3rd. We're pleased again to have Reverend Mark Marston. Please join in prayer.
Our Lord in heaven, we give you great thanks for the privilege of responsibility and the honor of holding the trust of others. Please bless us this day that we might use our talents, gifts, graces, energy, and time in your service and the service of this great state and country. Our Lord in heaven, as we enter in this season of Lent, please help us to be reflective, and please put your blessings on those who are in harm's way on this day. For these things we pray through Jesus Christ. Amen. Amen.
Thank you, Reverend. We appreciate you. Let's go ahead and call the roll. It looks like we have most folks here. Call the roll.
Convening roll for the 14th day, Thursday, March 3rd, 2022. Andrew. Baker. Banks. Bear. Blackburn, excused. Brown. Burkhart. Burt. Clausen. Connolly.
Here.
Crago. Duncan. Eklund. Air. Flitner. Fortner. Gray. Greer. Hallinan. Haroldson. Harshman. Heiner. Henderson. Jennings. Kenner. Knapp. Larson Lloyd. Larson Dan. LeBeau. McGuire. Nyman. Newsom. Nicholas. Oakley. Obermuller. O'Hearn. Olson. Ottman. Paxton. Provenza. Rodriguez Williams. Romero Martinez. Roscoe. Schwartz. Sherwood. Simpson. Summers. Stith. Stivar. Sweeney. Walters. Washit. Western. Worf. Williams. Wilson. Winter. Yin. Swanitzer. Mr. Speaker. Air.
Thank you very much, members. The Appropriations Committee is still working, so we'll excuse the Appropriations Committee, Kenner, Larson, Schwartz, Stith, Walters, Nicholas.
Mr. Speaker, 53 present, 7 excused.
Thank you very much. Someone's got a phone ringing. Please answer it off the chamber floor. I think we have a privilege here. I think we have some young guests with us today. Chairman Eklund, would you introduce these young folks?
Yeah, a privilege, Mr. Speaker. I would like to introduce two of my grandsons. They are cousins. You want to stand up? This is L.J. Hansen. His family farms and ranches with Susie and I, and we're in business together. And And this is Ethan Teeters. He lives in Goshen Hole, and they ranch down there. And these kids they're used to working, and so putting them to work would be a good plan. I think this one was farrowing during the night last night, and he doesn't look very worn out, so I think he needs more work to do. When people ask us why we're doing this, a lot of times we forget probably the most important part of it, the people that we do it for. And our families oftentimes at the front of the list. And believe me, that I wouldn't be giving up time with them to be doing this if I didn't believe it was important.
Well, welcome to the house. I think there's going to be some older siblings here this afternoon, so we'll get to meet some more of these folks. All right, is our doctor of the day back there? Chairman Harshman, is there a doctor sitting behind you on the bench? No. Nobody? Not yet. All right, thank you. Messages from this, what do you got? Journal. Oh, Journal Club. Journal Committee report?
Your Journal Committee reports that the Journal of March 2nd, 2022 has been read and recommends that it be approved. Representatives Provenza and Haroldson.
Messages from the Senate.
Message 188. Mr. Speaker, the Senate adopted the Committee of the Whole report failing the bill listed below by the vote indicated. House Bill 78, bid rejection or denial for public works contracting. Ayes 9, noes 21. This bill has been indefinitely postponed. Sincerely, Ellen Thompson, Senate Chief Clerk.
That's it. We need to make an announcement on those concurrences right now. All right, members, we have another privilege of the floor. Representative Simpson.
Thank you, Mr. Speaker, for the privilege. Members, good morning. For my birthday this year, my daughters got together and decided rather than to give me a tangible gift, they decided they would give me the gift of their time. And so you'll notice that I've been introducing daughters along the way. They've been visiting from long distances. I have yet another daughter visiting today. My oldest daughter is in the North Gallery. She reigns from the Wasatch Front, and her husband are raising 4 teenage children. She works for the city of Harriman Police Department, and one of her chores is to manage the crossing guards, 60 crossing guards they have in their city, ensuring that the kids arrive to school safely. Please welcome Bethany Zier.
Well, it's fun to have a family reunion. So glad you're all here. Nieces, sisters, oh, that's wonderful. Thank you, Representative Simpson. Any other privileges? Any other privileges? All right, members, on the 14th day, we're going to begin signing enrolled acts. We do have a doctor. We do have a doctor. So, ladies and gentlemen, Dr. Rob Munger, and it doesn't say where you're from, Dr. Munger, so I apologize, but welcome to the House and thank you for being here. We're at that order of business, is signing enrolled acts. The first enrolled act is number 1.
The Senate Enrolled Act Number 1, being original House Bill 23, an act relating to professions and occupations, amending provisions relating to the licensure of nursing home administrators, clarifying membership requirements to serve on the board of nursing home administrators, removing the ex officio member of the board, authorizing the board to impose continuing education requirements, providing for criminal background checks, making conforming amendments, requiring rulemaking, and providing for an effective date, being enacted by the legislature of the state of Wyoming.
I'm about to sign Enrolled Act Number 1, being original House Bill or Senate File 23. I have so signed. Next Enrolled Act Number 2.
Senate Enrolled Act Number 2, being original Senate File 31. An act relating to education, amending responsibilities for the enforcing compulsory attendance requirements, providing that a child subject to willful absenteeism is neglected for purpose of Child Protection Act, provided that a child who is habitual truant is a child in need of supervision, creating definitions, requiring rulemaking, amending penalties, and providing for an effective date, being enacted by the legislature of the state of Wyoming.
I'm about to sign Enrolled Act Number 2, being original Senate File 31. I have so signed. Next Enrolled Act Number 3.
Senate Enrolled Act Number 3, being original Senate File 2. An act relating to appropriations for the legislature, providing appropriations for the operation of the legislative branch of the state government, and providing for an effective dates, being enacted by the legislature of the state of Wyoming.
I'm about to sign Enrolled Act Number 3, being original Senate File Number 2. I have so signed. Next Enrolled Act Number 4.
Senate Enrolled Act Number 4, being original Senate File 29. An act relating to the Wyoming Governmental Claims Act, amending liability for governmental health care providers to cover only medical malpractice, making conforming amendments, specifying applicability, and providing for an effective date, being enacted by the legislature of the state of Wyoming.
I'm about to sign Enrolled Act Number 4, being original Senate File 29. I have so signed. Next Enrolled Act 5.
Senate Enrolled Act Number 5, being original Senate File 24. An act relating to professions and occupations, authorizing the administration of immunizations by pharmacy technicians and pharmacy interns, repealing the requirements for direct supervision of a pharmacy technician or a pharmacy intern by a licensed pharmacist, making conforming amendments, requiring rulemaking, and providing for an effective date, being enacted by the legislature of the state of Wyoming.
I'm about to sign Enrolled Act Number 5, being original Senate File 24. I have so signed. Reports from standing committees.
Senate File 26, sponsored by Judiciary. District Judge Positions Authorizing and Funding, an act relating to the judiciary. Mr. Speaker, your Committee Number 2 Appropriations, to whom was referred Senate File 26, District Judge Positions Authorizing and Funding. Respectful report same back to the House with the recommendation that it do pass. Ayes, Representatives Kenner, Schwartz, Simpson, Stith, Walters. Noes, Representative Larson Lloyd, Nicholas. Representative Nicholas, Chairman. Senate File 38, sponsored by Revenue, monthly ad valorem tax revisions, an act relating to ad valorem taxation of mineral production. Mr. Speaker, your Committee Number 2 Appropriations, to whom is referred Senate File 38 engrossed, monthly ad valorem tax revisions, respectful report, same back to the House with the recommendation that it do pass. Ayes, Representatives Kenner, Larson Lloyd, Nicholas, Schwartz, Simpson, Stith, Walters. Representative Nicholas, Chairman. Senate File 48, sponsored by Natural Resource Finding. 2022 Large Project Funding, an act relating to the Wyoming Wildlife and Natural Resource Funding Act. Mr. Speaker, your Committee Number 2 Appropriations, to whom is referred Senate File 48, 2022 Large Project Funding. Respectful report same back to the House with the recommendation that it do pass. Ayes, Representatives Kenner, Larson Lloyd, Nicholas, Schwartz, Simpson, Stith, Walters, Representative Nicholas, Chairman. Senate File 32, sponsored by Education, K-3 Reading Assessment and Intervention Program. An act relating to reading assessment and intervention. Mr. Speaker, your committee number 4, Education, to whom is referred Senate File 32 engrossed, K-3 Reading Assessment and Intervention Program, respectfully report same back to the House with the recommendation that it do pass with the following amendments. Ayes, Representatives Andrew, Brown, Harshman, Nyman, Newsom, Obermueller, Paxton, Summers. Excused, Representative Connolly. Representative Paxton, Chairman. Senate File 43, sponsored by Senator Wassenberger. Community College District Elections, an act relating to community college district elections. Mr. Speaker, your committee number 4, Education, to whom is referred Senate File 43 engrossed, Community College District Elections, respectfully report same back to the House with the recommendation that it do pass. Ayes, Representatives Andrew, Brown, Harshman, Nyman, Newsom, Obermueller, Paxton, Summers. Excused, Representative Connolly. Representative Paxton, Chairman. Senate File 78, sponsored by Senator Ellis. Language Proficiency, Seal of Biliteracy. An act relating to education. Mr. Speaker, your committee number 4, Education, to whom is referred Senate File 78 engrossed, Language Proficiency, Seal of Biliteracy. Respectfully report same back to the House with the recommendation that it do pass. Ayes, Representatives Andrew, Brown, Harshman, Nyman, Newsom, Obermueller, Paxton, Summers. Excused, Representative Connolly. Representative Paxton, Chairman. Senate File 10, sponsored by Agriculture. Predator Control, an act relating to agriculture. Mr. Speaker, your committee number 5, Agriculture, State and Public Lands and Water Resources, to whom is referred Senate File 10, Predator Control. Respectfully report same back to the House with the recommendation that it do pass. Ayes, Representatives Clausen, Eklund, Ortner, Heiner, Larson Dan, Western, Wharf, Winter. Excused, Representative Blackburn. Representative Eklund, Chairman. Senate File 81, sponsored by Senator Hicks. Clarification of existing state ownership of groundwater, an act relating to water. Mr. Speaker, your committee number 5, Agriculture, State and Public Lands and Water Resources, to whom is referred Senate File 81, clarification of existing state ownership of groundwater, respectfully report same back to the House with the recommendation that it do pass. Ayes, Representatives Clausen, Eklund, Fortner, Heiner, Larson Dan, Western, Wharf, Winter. Representative Blackburn, excused. Representative Eklund, Chairman. Senate File 12, sponsored by Senator Anderson. Airport Restaurant Liquor Licenses, an act relating to alcoholic beverages. Mr. Speaker, your committee number 7, Corporations, Elections, and Political Subdivisions, to whom is referred Senate File 12, engrossed, Airport Restaurant Liquor Licenses, respectfully report same back to the House with the recommendation that it do pass with the following amendments. Ayes, Representatives Burt, Clausen, Duncan, LeBeau, McGuire, Roscoe, Swanitzer. Noes, Representative Ayer. Absent, Representative Blackburn. Representative Zwanitzer, Chairman. Senate File 76, sponsored by Senator Case. Financial Exploitation of Vulnerable Adults, an act relating to banks, banking, and finance. Mr. Speaker, your committee number 10, Labor, Health, and Social Services, to whom is referred Senate File 76 engrossed, Financial Exploitation of Vulnerable Adults, respectfully report same back to the House with a recommendation that it do pass with the following amendments. Ayes, Representatives Connolly, Flitner, Hallinan, LeBeau, Ottman, Romero Martinez. Noes, Representative Stivar, Wharf, and Wilson. Representative Wilson, Chairman.
So members, just a quick announcement or reminder that we're going to start receiving concurrence messages as we just signed enrolled acts. So they, obviously we didn't change them and they concurred with our changes. But as we start receiving them concurrence messages, if you go to the website page and pull up those concurrences will be on the website page our LSO page under the bill versions and resources, where you have the introduced bill, the engrossed bill, the enrolled act type stuff. At the very bottom, there's the digest. At the very bottom, there's concurrence message. So you'll be able to all access in a PDF form that concurrence message on the website. So if you have any questions of where that is, the chairman, you will receive a paper copy of it. All other members, just take a look there on that, under the bill page. So I happen to be looking at Senate File 39, and bill versions and resources, concurrences are right there. Representative Walters, you have a privilege.
Privilege, Mr. Speaker.
Please proceed.
Thank you, Mr. Speaker. Please join me in welcoming the Executive Director of the Unaccompanied Student Initiative, or also known as USI, Austin Rodmaker. Austin is a 2016 graduate of the U.S. Air Force Academy, where he entered active duty as a 13N nuclear operations officer. He was stationed at F.E. Warren Air Force Base and elected to stay in Cheyenne following his service commitment, where he not only started the Laramie County Lacrosse Club, but more importantly, he is the head of the USI. And USI is a nonprofit organization that provides safe, stable housing and support systems for high school age students from 16 to 20 that are experiencing homelessness. And teenage homelessness is a serious issue here in Wyoming. And currently, USI operates in Laramie and Natrona County, and soon will have an operation in Albany County. And the goal is to provide shelter, safety, and guidance to homeless teens across our great state. Again, welcome, Austin, and he is in our gallery to the north, I believe it is. So welcome, Austin.
Welcome, sir. Thank you for your service to this country, and thank you for service to our communities. All right, members. We're at that order of bills on second reading, or third reading. Second reading, excuse me, second reading. First, Senate File 6.
Senate File 6, sponsored by Travel, Aquatic Invasive Species Inspection Enforcement, an act relating to aquatic invasive species.
We have an amendment. Chairman Eklund.
Mr. Speaker, I move second reading amendment number 1 to Senate File 6, and I would ask for your favorable consideration. When we had this discussion about the aquatic invasive species, there's a clause in there that allows 48 hours of grace for a boat that has been found not to have gone through inspection to be inspected. Well, I got to thinking, if somebody's in the state of Wyoming and they don't understand our laws, and that this is important to us to get those boats inspected, that possibly there could be some mischief. To clear it up, I brought an amendment. I went to the attorneys, asked them if it was clear about this inspection and that they have to keep it out of the water. It isn't. So I brought this amendment, and it's on page 2, line 4. After species, insert "and shall not enter Wyoming waters until the conveyance is inspected." And that is the amendment, Mr. Speaker.
Thank you. Any members first time? First time on the amendment? First time on the amendment? First time seeing none. Members, we are voting on second reading amendment number 1. Senate File 6. All those in favor, please say aye. Those opposed, no. The amendment is adopted. Senate File 6 having been read 2 separate times. The question is, shall the bill pass? Hearing no objection, is so ordered. Next bill is 35.
Senate File 35, sponsored by Minerals, Electric Vehicle Charging Stations, Regulation Exemption, an act relating to public utilities.
We have an amendment. Chairman Burkhart.
Thank you, Mr. Speaker. I move second reading amendment number 1 to Senate File 35 and ask for your favorable consideration. Ladies and gentlemen, this amendment probably should have come as a standing committee amendment, except the wording wasn't quite right. So I'm bringing it as a second reading amendment. What this does is 35 talks about electric vehicle charging stations and that they are not regulated as a public utility. They're a commercial retail operation. What the amendment does is to clarify that power from, if it's self-generated for an electric charging station, say by solar or wind or some other means, and then sold other than for electric vehicles, that really does become a public utility. They're selling something, call it wholesale. Our interstates, the distances between those and towns are far enough apart that this could become an issue with where you can place these charging stations along mostly our interstate highways. So I'd ask for your favorable consideration. It just clarifies the bill to make sure that charging stations that buy their electricity from a utility are not a utility, but those who self-generate and try to sell it are, to keep people from doing that. So with that, I'd stand for questions.
Thank you. Members, first time. Representative Yen, first time on the amendment.
Thank you, Mr. Speaker. So just a question, because I was looking at the amendments on the Senate side, and there was a very similar one that was put on the Senate side and then removed by the same amendment sponsor the next reading, and I'm just wondering what that discussion was. And is this something that we also do for compressed natural gas stations, or is it specific to the electrical stations? Thank you, Mr. Speaker.
Any other members, first time? Members, first time. Members, first time to the sponsor, Chairman Burkhart.
Thank you, Mr. Speaker. To answer those questions, the reason it was removed on the other side was the wording was not quite right. Even the utility companies indicated that. They spent quite a bit of time working on getting this wording right. And again, it's if you're generating electricity, whether it's wind, solar, whatever, and that for a charging station, that's fine. If you're trying to sell it to others, ranchers in the area who want to buy it from you, maybe other businesses, then you are distributing it as a power company. So it just clarifies that they would be part of a public utility if they do that. As for the compressed gas stations, we exempted them from public utilities quite a while ago. And most of the compressed gas stations were never generating their own compressed gas. I mean, they didn't have a well sitting right there. They were buying it. So they, again, were exempted because they were selling it on a retail basis. Thank you.
Thank you. Members, we are voting on second reading amendment number 1, Senate File 35. All those in favor, please say aye. Those opposed, no. The amendment is adopted. Senate File 35 having been read 2 separate times. The question is, shall the bill pass? Hearing no objection, or shall the bill be heard a third time? Hearing no objection, is so ordered. Next, Senate File 45.
Senate File 45, sponsored by Transportation, Military Department Annual Report. An act relating to Defense Forces and Affairs.
Senate File 45 having been read 2 separate times. The question is, shall the bill be read a third time? Hearing no objection, is so ordered. Next bill, Senate File 46.
Senate File 46, sponsored by Minerals, Solid Waste Cease and Transfer Program Funding. An act relating to the prioritization of municipal solid waste facilities, cease and transfer projects.
Senate File 46 have been read 2 separate times. The question is, shall the bill be read a third time? Hearing no objection, is so ordered. Next, Senate File 57.
Senate File 57, sponsored by Appropriations, Chancery Court Vacancy Amendments. An act relating to courts.
Senate File 57 having been read 2 separate times. The question is, shall the bill be read a third time? Hearing no objection, is so ordered. Next, Senate File 58.
Senate File 58, sponsored by Appropriations, Wyoming Council for Women's Issues Workforce Services. An act relating to the Wyoming Council for Women's Issues.
Senate File 58 having been read 2 separate times. The question is, shall the bill be read a third time? Hearing no objection, is so ordered. Next, Senate File 59.
Senate File 59, sponsored by Appropriations, Game and Fish Fund Investments. An act relating to public funds.
Senate File 59 having been read 2 separate times. The question is, shall the bill be read a third time? Hearing no objection, is so ordered. All right, ladies and gentlemen, with that order of business of bills on third reading, final passage, I hope you have your coffee. First bill for our consideration is Senate File 66.
Senate File 66, sponsored by Appropriations, American Rescue Plan Act Recovery Funds Appropriations, an act relating to the emergency expenses of government being enacted by the legislature of the state of Wyoming.
We have an amendment. Representative Western.
Thank you, Mr. Chairman. I withdraw third reading amendment number 1 to Senate File 66.
Number 1 is withdrawn. Number 2, Chairman Wilson.
Thank you, Mr. Speaker. I move third reading amendment number 2 and ask for your favorable consideration. Folks, just looking at the amendment, it looks rather obscure because all it says is page 4, line 10, up 5 million, and page 4, line 24, down 5 million. So what I will explain what that is I want to, the line 24 is the capital construction for healthcare, which has been added to and added to and added to, and frankly, you know, we don't really need a lot more buildings if we haven't got any staff to put in them. So I want to take 5 million from the capital construction and put it in the staffing stabilization, which is line 10. This is not ongoing operations in staffing. These are for enable our healthcare providers around the state, mental health providers and so on, to do recruiting, retention bonuses. You know, the labor challenges are pretty significant now, and that would just help them maintain their staffing. So I'm just making a little move there.
All right, members, any member first time on the amendment? First time on the amendment? First time. Chairman Harshman.
Thank you, Mr. Speaker. I'd like to divide that amendment.
And your division is lines 1 and 2 being one division and the rest of the division being another one?
It is, and I got to get it in front of me. I've got it on my computer and I'm trying to.
All right, so I believe I understand you're dividing lines 1 and 2 as a Division 1, and the rest will be Division 2. All right, proceed as you'd like, Chairman.
Thank you.
Which division, let us know which division as you proceed.
Well, okay, so Mr. Speaker, Division 2 starts on line 4, the decrease, correct? I just want to make sure I.
3 through 4, or yeah.
Thank you.
3 through the rest of the amendment is Division 2.
Part of the problem, you get older, can't hear anything. And I'm trying to get it right, but I think I got this. So I'd like to, Mr. Speaker, if we could start with Division 2.
Please
Okay,
proceed.
thank you, On. And I just think this amendment, and I agree with Division 1. I agree. I think, and there's 50 million, I think, and other workforce training in this bill already. I think that's all good, but I don't think you add to that by subtracting from others. And I think if we want to add another 5 million for healthcare and workforce, I'm all for it. I really think we need all of the above. And you know, you look in our hospitals and our nurses, they're all travelers. I mean, it's incredible. And Wyoming has a growing problem with a shrinking solution. But I don't like the part where we got to take it from here to do a pay for. I just don't think that's the way we want to do this. This body was really supportive of trying to move some of these facilities forward in one-to-one grants, and then we take 5 million and pop out of that. I think I'd oppose that. So I would encourage a no vote on number 2. And then when we talk about number 1, I'll be more supportive and cheerful. Thank you, Mr. Speaker.
Thank you. Any other members on Division 2? Chairman Wilson.
Thank you, Mr. Speaker. Folks, I deliberately wrote the amendment so it would be divisible, so we could consider this. And when I wrote the second part here about taking it from the CapCon, frankly, I'm just wearing my old appropriator hat and trying to balance things out and not take more than my fair share. So up to the body.
Any other members? Representative Larson Lloyd on Division 2, lines 3 through the remainder.
Thank you, Mr. Speaker. If I may, I just want to provide a little insight as you consider what you're going to do on this bill. Early in the process of getting the ARPA funds, the chief executive of the state leavened a chunk of the ARPA money out to do this stabilization effort in most of the hospitals. And which was a good thing and is an important thing to do. So then the conversation was, well, what about the other people that provide similar services such as rural health care, primary care facilities, long-term care facilities, the vulnerable populations and the at-risk populations, which did not benefit from that B11 process of the ARPA funds. And so the conversation was started at that time through the task force to the Department of Health in getting some funds out to these specific providers that did not receive funding in the first round. And so I just want you to know that in that pot of money, that's where it's going to be going for stabilization. It's not going to be going to the hospitals that received it in the first round. It's going to be going to those providers that didn't receive the first round of stabilization. So just think that information is important for you to understand.
Other members, first time, Division 2, first time, Division 2, first time, Division 2, second time, members, Chairman Harshman.
Yeah, thank you, Mr. Speaker. Again, just to encourage you to vote no on this division, and then we move on to Division 1. Thank you.
Thank you. Members, we're voting on third reading amendment number 2, Senate File 66, Division 2. Division 2. All those in favor, please say aye. Those opposed, no. Amendment, the division has not been adopted. Back on Division 1, Chairman Harshman.
Thank you, Mr. Speaker, and I appreciate the good chairman, Madam Chairman, bringing this amendment. I'm going to support this. There's 10 in there. There's 50 more with the governor, but I think these ARPA funds really, I think that's what we're trying to do with them, and to plug some holes and make us move us on to the next level in some of these areas. We've learned a lot, so I'd be in support of that Division 1. Thank you.
Any members on Division 1? Members on Division 1. Representative Washut, Division 1.
Thank you, Mr. Speaker. It's a little more detail on how exactly throwing this money at this problem is actually going to be used on the ground to address the staffing problems. I think we just heard that there's a shrinking solution, but I do want to know how adding this money solves the problem. And did these facilities and institutions receive other federal funding for this very same purpose previously? Thank you.
Thank you. Members, first time, Chairman Wilson.
Thank you, Mr. Speaker. So in discussions with some of my local providers, some maybe have received some funding, others have not. I know one of the local providers has had 60% turnover this year. That's a lot of churn. And so to be able to, and many of these, some of the programs we're raising the Medicaid rate, others we are not. And so in lieu of having continuing ongoing operation, we haven't raised the rates for some of these folks. Some of them have had their budgets cut, but the idea would be that they could at least offer, a signing bonus, or, hey, you've been here for a year, so I'll give you an extra $500. Also, some of the places, long-term care facilities especially, are having to hire traveling nurses. They've had, there's been a lot of turnover, a lot of departure in the healthcare workforce, and obviously, if they're happy and have well-paid staff, then they won't get any of it. But I think there's a lot of folks out there, and I just really want to keep our mental health providers, our DD providers, our nursing homes able to keep working with their patients for another year or two. After that, I have hopes that things will stabilize. That's why it's okay, I think, from my mind, to use the ARPA dollars.
Thank you. Majority Floor Leader Summers, first time, Division 1.
Mr. Speaker, thank you on and support. I know, and I don't know all of the details of this money, and I'm sure the good appropriator will tell us, but I know early on, because we were a clinic and not a hospital, our community was not able to utilize this money. And we had a lot of needs. I mean, it was hard to get temps. We were losing staff that were becoming temps in other places. We really do need some stabilization of these healthcare staff, and I would urge your support.
Any other member? First time, Representative Larson Lloyd, first time on Division 1.
Thank you, Mr. Chairman, and to the good representative, retired law enforcement officer that asked the question who these would go to, and I apologize that I didn't explain it very well the first time. So when the chief executive looked at the impacts of the pandemic, and there were a lot of funds coming in to provide, to shore up the ability to get temporary staffing. And you had nurses and doctors, temporary people coming in, and the costs for those were pretty significant. But yet you had those people that weren't temporary. They lived down the street from you, and these funds weren't being used for retention or other things to keep the people that had been there and had stayed through the pandemic, providing these services through the long months that persisted. And so the chief executive pulled some money out, and he says, we need to give this for retention over time and to shore up that staff that have stayed the course, and they're going to be, that have been citizens of our state and are going to be staying here for the long term, and so that they're not jumping ship and leaving us as well. So then when after that was done, and we found out that we had people, the folks that have developmental disability services, the intermediate care facilities, the community choice waiver providers, congregate case providers, hospice providers, mental health and substance abuse providers, freestanding emergency rooms, primary care clinics, and human service providers who also have a real commitment from their local resources to provide that significant one-on-one care to protect the health and well-being and provide the services for these populations served. We task the Department of Health to come up with an idea of how that could be distributed and what it would take. And so using a model somewhat similar to what they used to provide to the hospitals is how they come up with that original $10 million. This is not intended to reimburse providers for temps. This is for retention of existing staff. So that has to be segregated out there a little bit. So that 10 million was kind of set as what it would take to bring that up to parity on the retention bonus that the hospitals got. What does the 5 million extra do? Well, what does 5 million anywhere do? It gives you more flexibility, more ability to do things. But it's important to understand that the original 10 had them up to the same amount of what the first B11 to hospitals was.
Any other members? First time, Division 1, first time, Division 1. First time, Division 1, second time, second time. Is anybody in the house? Second time, seeing none. Members, we are voting on Division 1. All those in favor, please say aye. Aye. Those opposed, no. The division is adopted. Division being called. All those in favor, please stand. Those opposed? So the amendment has not been adopted. My apologies. The division has not been adopted. 2630. Chairman Zwanitzer? I have the next amendment, sorry. It's 3003.
The next amendment for our consideration is third reading amendment number 3. Representative Barlow.
Thank you, Mr. Chairman. So, Mr. Chairman, I move third reading amendment number 3, Senate File 66, and ask for your favorable consideration. Members, actually, this just builds off that last discussion we had about that 50 million. Now, we were talking about 10 million, 5 million, moving some money, but we recall you heard reference to a $50 million pot that the governor has to address the negative impacts of COVID-19. All this is doing is trying to give him some guidance, if that, just a gentle, hey, consider these type of things. So if you'll read just right through these, it's pretty straightforward stuff. Reimbursements to health care providers for uncompensated care. Members that have been here before know uncompensated care is a challenge. Now, if you are uninsured, have COVID-19, maybe the COVID-19 associated costs would be reimbursable, i.e. through some programs. But if you had a comorbidity, i.e. another condition such as diabetes or something else that became aggravated and you were in the hospital for that as well, and you could not afford the care, this would help cover those things. So you're in the hospital for the disease, the pandemic disease, but you have underlying conditions and that become exacerbated. This would help those folks because they would not maybe be otherwise covered by other funds, if you will. The second one, expand access. We've had several discussions about whether we're willing to, we didn't get to those discussions about expanding access to folks that are in this gap, can afford health insurance or cannot. So they are uninsured. Well, for some folks with a modest income change, $100, $200 a month, they could have access to the marketplace and have health insurance through the private marketplace. I'm not suggesting the chief executive might think this is a good idea, but I want to lay it out there as a possibility. It's a necessary, we can call it a necessary support of the poor, which is a constitutional option that we have. Our Constitution allows us to do this. Same with the first one, or would allow this to be done. The last one is the healthcare providers, and as many of you, we talk about rural clinics, we talk about large hospitals, et cetera. And I hope we are well beyond the majority of this stuff, but as a community, a clinic, hospital has impacts, they're limiting their services. Their money-making services. Can't do elective surgeries, can't do other things. So that impacts their ability to keep cash flow, to keep the very employees that we were trying to keep with those other things. So let's not only keep the employees, but let's help them maintain a little bit of cash on cash balance when they're actually losing services that they can't provide in the community, the paying services. So this is not saying you have to do this, but I'm just trying to open the possibilities that their chief executive, instead of just saying, here's X amount of dollars and it's 50 million, do whatever you need. I'm just trying to provide. It doesn't say it's exclusive to this. It's just here's some suggestions that the advocates, those associations that take care of hospitals or take care of nurses or take care of all those, they can say, hey, Governor, this is on the table. Could you look at a program like this? Let's help solve our own problems. We want to be part of this process. So that's all this is. Maybe just a little bit of a guide map to say, hey, here's some options for you. With that, Mr. Chairman, I'm glad to stand for any questions.
Discussion on the amendment. Representative Stith.
Mr. Chairman, thank you. I do have a question for the sponsor about the effect of Romanet 2 in the amendment and the phrase assistance to individuals so that they would qualify for health insurance. And my question is this, we're not a Medicaid expansion state, so as a result of that, we've got maybe some 18,000 people maybe who are in a gap that don't qualify, they don't get Medicaid, but they also make too little to qualify for the healthcare exchange. It looks like this Romanet 2 would authorize the governor to spend this $50 million for direct cash assistance payments to raise their income. So if let's imagine I'm at, I apologize, I don't know the income limits, I'm sure the sponsor does, but let's imagine I'm making 75% of federal poverty level, I'm really poor, right? A household of two, I'm making only $16,000 a year, so I'm in this gap. I can't even get on the healthcare exchange because I make so little money. So it seems like I just want to find out what this means. It seems like, does Romanet 2 mean that it would authorize the governor to give, say, a check for $5,000 to this family, or $6,000 or $8,000 direct payment to raise their income to, say, 101% of federal poverty level, which would then allow them to get on the Obamacare, the healthcare exchange? So that's my question. And if that's the case, then just, again, information purposes only here, it seems like if it would allow the executive to hand out $5,000 and $6,000 and $7,000 to however many thousands of households, that Romanet 2, it seems like, would potentially eat up the entire $50 million if it were used. That's what it looks like to me, but I may be reading it wrong. I'm just asking the sponsor for clarification on exactly how this works. Thank you.
Thank you. Vice Chairman Larson.
Thank you, Mr. Chairman. And my questions were really similar to the last speaker back, and to our good speaker to give a little clarification on how he envisions that working. And I think we actually have two groups there. The group that was just mentioned, who fall in that 0 to 138 or 150% of poverty level, that make too little to get any insurance on the exchange. How do you see this working for them? And then there's that group that is about 150% up to 200% or 250% that qualify for subsidies but still find the subsidies too expensive, the premium even with the subsidies too expensive. Just trying to get an idea of how he envisions that, because we don't give much direction to the governor here. And so are we to conclude then that we'll leave this kind of in the governor's office to flesh out and work the best way to do this? And then if I could ask a follow-up question, Mr. Chairman, to the good speaker on Romanet I on the reimbursement for healthcare providers for uncompensated care, is that definition and the costs related to uncompensated care, is that there, as we learned, that there's a published, if you will, cost that maybe healthcare providers have, and then there's a percent that they'll accept that insurance will pay or Medicaid pay. And so I'm just wondering how he envisions, or what he envisioned that uncompensated care costs being. I think that these are all very legitimate concerns, and I think as we try to address the things that are impacting people, because it is people and not just businesses. I fully understand, but would like a little clarification on that if we could.
Vice Chairman Brown, first time.
Thank you, Mr. Chairman. On and for the amendment, ladies and gentlemen, and then there's a couple of reasons why. First and foremost, we've got a hospital that we can look out of these windows here, and we can see that one. It's one of the largest in the state, and uncompensated care, they'll do uncompensated care in the realm of $20 to $30 million a year. And COVID only exacerbated that issue. It was a very large issue here, and I think in a lot of your communities as well. But one of the other things that, the discussion seems to really be focusing on that Romanet 2. That Romanet 2 is a smaller portion of this discussion, but it's an important one. And we actually already have programs that are in line. We actually already have programs, and one of them it's a state-funded program at a certain point, but we also have tons and tons of federal money that is out there trying to work it out right now. And this would just be in addition to, and trying to supplement that program with a little bit of additional assistance. Keep in mind that this is also not directing our chief executive to do this. This is just we'd like you to look into this. And so we're not directing the governor the chief executive, that you have to do this. This is just an opportunity for our community-based health systems to receive some money back for the amount of money that they're having to fork out right now. You look at traveling nurses across the state and across the country. People are leaving their jobs internally and they're going to these traveling agencies, and it's 3 and 4 times the amount of a normal nurse. And you're looking at millions of dollars a month that they're having to spend out on these, and this would just augment some of that loss. And a lot of that does have to do with the fact that you have a hard time attracting a nurse right now that when they can find that money floating around out there. So on and for the amendment, and I appreciate the good speaker bringing this forward. Thank you.
Representative Walters.
Thank you, Mr. Chairman. A question for the good bringer. In the event that the chief executive were to set up one or all of these programs or any one of them individually, this is one-time funding that would get these up and going and started and make these reimbursements and assistance. What would the state's responsibility be in terms of an ongoing cost? Would be the first half of that question. And the second half of that question would be, what would be the difficulty of removing the state from being involved in these situations? So basically, would we be pulling the rug out from under somebody or a provider after we set it up? Because remember, folks, that the funds in this bill are one-time in nature. And so I would have a concern if we are setting the state up for an ongoing expense by starting down a path of this. And I would note again that this is just more guidance to our chief executive, but if he were to follow these recommendations, what is that ongoing expense that the state could potentially incur?
Anyone else for their first time? First time seeing none. Representative Knapp, first time.
Mr. Speaker, first for a second.
First. Anyone else for their first time? Seeing no one else for the first time, second time before the sponsor. Anyone wish to speak on amendment number 3 for the second time? Representative Knapp.
Thank you, Mr. Chairman. On and against the amendment. This is a little concerning, especially with Romanet 2, assistance to expand access to health insurance coverage. To me, is a policy issue that this body should discuss either in a bill going forward, and that didn't happen this session. But to advise the governor to possibly go off on a policy issue that this body hasn't discussed or confirmed, I think is a mistake. So on and against.
Anyone else for their second time? Second time, Vice Chairman Larson.
So, Mr. Chairman, I'm getting better at this. Mr. Chairman, I think we want to be a little bit careful and not make the assumption that we're giving the executive officer the authority to expand Medicaid under the Affordable Care Act. That doesn't do that in this amendment. But what we do have in your communities and in mine, because the Supreme Court ruled that expansion of Medicaid is not constitutional, you can't force a state to do that. We've got these people here who are 0 to 130% of poverty level that because they don't make enough money, they can't qualify for any subsidy, can't get it. They can't afford it because they don't make enough money, and they can't take advantage of any programs because they don't make enough money. They're just kind of trapped. And so I think what this amendment is trying to do is say we've got these citizens trapped in here. It has nothing to do with what expanding, but they're trapped in here, and they may have these, they can't get services unless it's to the emergency room or whatever. And so I think that's, as you look at that language in the amendment, be careful not to confuse it that it's an attempt to expand a policy or something. It's really, I think, designed to try and help some folks in the state.
Anyone else for the second time prior to the sponsor? Seeing no one, back to the sponsor, Representative Barlow.
Thank you, Mr. Chairman. So I appreciate the conversation and I appreciate the questions. The three Romanettes are actually out of federal guidance. This is out of federal guidance. They're just maybe modified a little bit to be a little more Wyoming specific. These are the approved uses for ARPA funds in the healthcare setting. What we have with this bill is no guidance except for the federal guidance. So what I actually believe I'm doing is putting some sideboards, Wyoming sideboards. Now I appreciate if Romanet 2 is more challenging, that's a case we individually make with the executive branch. To the question about, does that mean somebody could get and we're really talking about people from 100 to 138% federal poverty level. That's basically a $5,000 range for individuals. And my view was, I don't see a place where we say we're writing people $5,000, but we might match a employer's contribution so that their employees could have health insurance, because some of them, as you know, health insurance is a challenge for employers. But if we could help partner with employers to say, hey, we're going to get your employee health insurance, or we'll help you get insurance, partner with us. I didn't go into that level of detail here, but I think that there are opportunities here to actually leverage, to actually help bring partners into this. Employers, nonprofits, other folks that want access to healthcare, want people to have access to healthcare so we can avoid the other two, right? The uncompensated care issues. The uncompensated care issues. So this guidance, these three Romanettes they're part of the ARPA fund. They're part of where we are. What I've tried to do is, what do we have challenges with in Wyoming? How did that guidance fit for Wyoming? Uncompensated care, this body made direct payments to healthcare providers, hospitals in particular, probably in 2016 because of uncompensated care challenges that were being happening in this state. We wrote checks to them. Pro rata, based on whatever their uncompensated care was, divided up over all the money. And then there was a question, I'll try to get back to the question, Mr. Chairman, I apologize. So I think I covered that. One time versus ongoing? Absolutely. Whatever is done with this money is one time, whether we give guidance or not. That's part of what we understand. This is a one-time bill, folks. I mean, I truly hope we don't do this again in 2 years, or there's not another thing. So whatever the understanding has to be that this isn't ongoing. But if we can use some of this money to give folks that first step to coverage, and then figure out how they can figure out how to keep it going, I guess I don't find that to be problematic. But everybody should understand that with guidance or no guidance, this is still one-time money for whatever purpose. The policy issue, there was a comment about it's a mistake. This is a policy, this is a mistake. No guidance might be a mistake, and that's what you have in the bill as you have now. No guidance. This is $50 million the chief executive can use. I'm just going to say, here's some suggestions. Here's some suggestions that I think actually address Wyoming challenges that I had in my 8 years on the Labor Health Committee. I continue to hear, as a good chairman, we visit about what challenges we have in Wyoming, and I hear from the advocates out in the communities. So the policy, the mistake to me is not saying, hey, we think these are some good ideas. Now, whether the executive decides they're good ideas or has other good ideas of their own, absolutely fine. But these are within the guidance, and they're specific to things that Wyoming legislators that have been here for 6 to 10 years have actually dealt with and tried to get their arms around. So, Mr. Chairman, I think I'll just summarize again. Romanet 1, it's directly related to COVID-19. That's a function of the ARPA funds. COVID-19, your costs may be covered, et cetera, but if you have a comorbidity, other things may not be. Second one, yes, it is trying to find partnerships, maybe in the community, nonprofits, employers, whatever they may be. One employer in my community was able to offer health insurance, 5 employees, able to offer health insurance until about 3 years ago. No longer can do that. One of his employees might actually qualify under this, the rest were higher, they're in the income bracket of higher. But if he maybe had something, that one person, and maybe those other folks, they have insurance elsewhere, but that one person now has no options, no options. Maybe this is a way to provide some folks an option. And then the negative economic impacts, well, we know that's happening every day. And this is the negative economic impacts, because we're going to build all these facilities around our state, small communities, new ones, and other communities. They got to still be running in 5 years. They still got to be running in 5 years. That's where we actually get the dividends from the buildings, is still operating with nurses and doctors and healthcare staff and support staff, employing people, but keeping our communities healthy. So I'd ask your favorable consideration on this amendment number 3, not because we are providing some guidance, Wyoming guidance within the big framework of the guidance for $50 million, which right now has no guidance from this legislature. I'd ask for your favorable consideration. Thank you.
We're on third reading amendment number 3. All in favor of the amendment, please say aye. Aye. Opposed, say no. Third reading amendment number 3 has passed. Division being called. All in favor of the amendment, please stand. Amendment is passed. We're going to move past third reading amendment number 4, move that to the end. So we're at third reading amendment number 5. Chairman Wilson.
Thank you, Mr. Chairman. I move third reading amendment number 5 to Senate File 66 and ask for your favorable consideration. Folks, all this does, yesterday we approved an amendment to provide some funding for grants to law enforcement to improve mental health services. And after talking to some of the interested parties and frankly having lunch with first responders yesterday, although they didn't campaign for this, but we were exchanging war stories. What I'm bringing this to do is to add emergency medical service providers to the folks that could receive these mental health services. And, often, of course, law enforcement and EMS are working together anyway, so it probably wouldn't need separate ones. You could bring them in together. I do just want to say one thing in the amendment. Because of the way the sentences worked, now it says first responder or emergency medical services before the county and municipal law enforcement. I just want to say that I'm not intending to disrespect law enforcement at all by that. It was just for clarity because it says county and municipal law enforcement, and if I had said county and municipal law enforcement and emergency medical services providers, it would have sounded like perhaps county and municipal also applied to EMS. And of course, EMS may also be a nonprofit or volunteer. So that's just why the ordering is changed on that. Other than that, that's all that it happens here, is it just adds this other group.
Representative Yin.
Mr. Chairman, vote aye. Thank you.
Any further discussion? Vice Chairman Washut.
Thank you, Mr. Chairman. Just an inquiry about fire service personnel. Are they included in that definition in 102 as emergency medical individuals, or would this have our ambulance, EMS folks, and law enforcement, but exclude fire?
Further discussion, first time, second time, part of the sponsor, seeing none. Chairman Wilson.
Mr. Chairman, thank you. And I don't have my statute book open in front of me, but my recollection is when I looked up the definition of first responder yesterday, that it does have fire in there.
We are on third reading amendment number 5 to Senate File 66. All those in favor, please say aye. Aye. Opposed, say no. Third reading amendment number 5 has passed. We are now on to third reading amendment number 6. Representative Stith.
Mr. Chairman, members, I move third reading amendment number 6 and ask for your favorable consideration. This would take the funding level for the EMS pilot regionalization program to the level that our chief executive and the healthcare task force that met over the past year recommended. You'll notice on page 4, there are 2 line items for ambulance. The first line item is on, I think, line 14 is for $5 million for so-called stabilization. And then line 15, which this amendment affects, is for a regionalization pilot. The concern with, and initially the healthcare task force and our chief executive had recommended $10 million for each. As you know, ambulance service is a business that has high fixed costs, right? Because you not just got your equipment, but you've got a staff at 24/7, 365. You have high fixed costs. If you're in a sparsely populated area with low volume, it tends to be a losing business. And so in our rural areas, ambulance service is just kind of a bad business to be in, right? So in my county, for example, we have a private ambulance service provider, but they lose money, and so it falls to our county commissioners to effectively subsidize them by giving them $1 million a year. And that's really not great. That's not really efficient. If we could regionalize the ambulance service instead of having them chopped up between different communities, the idea is it might be more efficient. When the healthcare task force met over this past year, this regionalization pilot is actually not targeted to my community. It's actually targeted up north, closer to the Montana border. And the problem with the $5 million is that it's just enough money for them to fail, okay? It's just enough money for them to not make it work. And so this $5 million ask does keep the match so that the local community does have some skin in the game, but it takes it back to the governor's recommendation. And the idea is you use this money to try to find a longer-term, more efficient way of organizing your ambulance service in your different communities. So with that, please vote aye.
Discussion on the amendment? Seeing no discussion on amendment, all those in favor of third reading amendment number 6 to Senate File 66, please say aye. Opposed, say no. Third reading amendment number 6 is passed. We're now on to third reading amendment number 7. Representative Walters.
Thank you, Mr. Speaker. I move third reading amendment number 7 to Senate File 66 and ask for your favorable consideration. So members, what this is this is just really a guidance to the chief executive on how to prorate these funds in the event we overspend these funds. And so we are headed down a path of getting that done. The chief executive does have until March 26th of this year to spend these funds before this bill would go into effect. He just today, I believe, did a couple B11s. He can B11 money between now and March 26th. So we don't know where this fund would end, where these dollars will end up before the 26th of March. And so what I've done here is brought in some language just to give him guidance on how we would expect, we the appropriate legislative branch, the appropriations branch of government would expect him to prorate these funds in the event it's overspent. Now, there's a couple things that are said they are exempt from the proration, you might say. And the reason, the first two in Romanettes 1 and 2 are because those are in place in this bill as they are how we are gaining conserved dollars through our process this year. And so we put these normal expenditures into the ARPA direct bill that we're discussing today. And then by doing so, we were able to take the general funds back out. So that's how we get to on the first two. The third one is in the judicial branch, and I exempt those because I have some concerns of separation of powers issue for the chief executive to be telling the judicial branch how to operate their budget. And so I just felt that it didn't make sense for those separation of powers issues. So again, this is just how do we give the chief executive some ideas in terms of what prorating it in case we oversubscribe this fund, and I would ask for your favorable consideration to this.
Discussion on third reading amendment number 7. Chairman Nicholas.
So the drafter of this is a genius with a J, so I'm voting for it.
Further discussion, first time, second time for the sponsor. Seeing no further discussion, all those in favor of third reading amendment number 7 to Senate File 66, please say aye. Opposed, say no. Third reading amendment number 7 has passed. We are now on to third reading amendment number 8 on Senate File 66. Representative Western.
Thank you, Mr. Chairman. I withdraw third reading amendment number 6 to House, Senate File 66.
8.
8.
Without objection, third reading amendment number 8 is withdrawn. On to third reading amendment number 9 via Chairman Wilson.
Thank you, Mr. Chairman. I move third reading amendment number 9 to Senate File 66 and ask for your favorable consideration. So folks, where this goes is we had an amendment, I guess it was yesterday. Doesn't seem like time is sort of sloshing all together. Hardly remember what month I'm in. We had an amendment to set up a physician assistant program. And we had some good, robust discussion on that as to whether picking one category of healthcare worker without a lot of consultation and setting up an ongoing program with one-time money that might was not that clear was the best idea, which personally I didn't think it was. So I have the amendment number 9. Instead of having $1 million, has $200,000. And the intention of the amendment, and I'll kind of summarize that long paragraph, still to appropriate it to the College of Health Sciences, but to have them work with the community colleges and workforce services to actually identify where the gaps are in Wyoming's healthcare workforce, to look at where those workers are trained. There are many types of healthcare professionals that we don't have training programs for in this state, and the kids, I would think, or second career people would have to go elsewhere and maybe or maybe not come back, and then determine what programs should have the highest priority, where we would set them up, what kind of accreditation is needed, who do we have for faculty, who do we have for classes. My point in bringing this is that I think most of us in a state like Wyoming realize it's better to identify the target before you pull the trigger. So that's what I see this amendment is doing, is something really, and this is something that we've tried to do in Labor Committee for several years, but frankly with COVID and with, we don't have the staff to really do this study. We've brought in bits and pieces of this information, but I really think we need a good solid analysis of where we're at with our workforce and where we ought to go with our workforce, and do that with this ARPA dollars rather than set up a program right out the gate. So that's what this amendment does, and I'll be glad to take any questions.
Discussion on third reading amendment number 9. Chairman Harshman.
Thank you, Mr. Chairman, and to save a little time before we go down, Mr. Chairman, I'd like to divide this amendment. I'd like to divide it, lines 1 and 2 are Division 1, and then 3 through 30 are Division 2. Thought I'd try to divide it early before we don't have a lot of debate that we got to re-debate.
I'll rule that is divisible. Would you like to be Division 1 first, Chairman Harshman?
Sure, Mr. Chairman.
Division number 1, again, which is lines 1 and 2. Go ahead.
It is really hard to hear in this corner. Anybody else notice that, or is it just me? Too many antelope pumps without. Okay, yeah, I hear you. Okay, Division 1. I would encourage a no vote on Division 1. And I don't know if it's Providence or what, but speaking with the good doctor of the day back there, and he works in our medical education with preceptors, 200 preceptors around the state. And there's all this stuff. It's not like we haven't been working on physician assistants for the last 10 years, right? We've been working and working and working on this. And the amendment yesterday doesn't set up the program. It says to pursue and study and go down this road. Now, in regards to other healthcare providers, absolutely. I agree with the good chairwoman of Labor Health. And we got to keep working at this thing. It never ends. It's part of our job here, stuff that never ends, and legislators talked about it before us, and they'll talk about it long after we're gone. So I would encourage your no vote on 1. I think we did something really good, and it'll be really important for our rural communities, our state, our healthcare system, and vote no on number 1. And because I really appreciate your support yesterday for that amendment, and I think we're, again, I think doing some great stuff. So thank you, Mr. Chairman.
Thank you. We're on division number 1 of third reading amendment number 9 to Senate File 66. Vice Chairman Brown.
Thank you, Mr. Chairman. I'm going to read verbatim from our amendment yesterday that was passed. And it says, this appropriation to the University of Wyoming's College of Health Sciences is for purposes of setting up and developing an accredited physician assistant training program. Believe that completely contradicts what the good chairman of revenue just stated, that we're not setting up a program. It said that we were going to go over a study and we were going to look at this. We are setting up a program, and that's where my heartburn with this particular amendment came from, is we're going to feed $1 million into this budget right now with no understanding of what that is going to look like into the future. I have zero qualms with trying to get more professionals in our healthcare facilities across the state and trained at our university. I think it's a fantastic idea. I just think our university should probably be brought into the mix on this and get a little bit of an understanding of what they think and how we see the rest of our state being brought forward. We have plenty of other healthcare professional needs out there, and I'm not sure that PAs are the only one. I'm not sure that they're the highest priority. I don't think anybody in this room knows that. But we are going to make a policy decision with lines 1 through 3 of this particular amendment that says, if we delete this, that we're going to trust that the university will go in and they will study and they will determine what the highest priority needs are. And then we'll look together, once we have that, we'll look to start establishing new programs if we need to. If we need to. But if we delete this and we say, no, we're not going to do this, what we're ultimately saying is, well, we're going to throw $1 million at this setting up and for purposes of setting up and developing an accredited physician assistant training program. We're going to do that. We're making a policy decision with one-time funds that are going to expand into the future. I don't have a problem with us having a discussion about this, but setting up a program with one-time funds means that the rest of the state is going to be on the hook in the future on this. So I would encourage an aye vote, and I also would encourage an aye vote when we get into Division 2. Thank you.
Representative Western, Division 1.
Thank you, Mr. Chairman. I rise against it. And you're right, the amendment yesterday started that process of setting up a program. And in terms of priority of order and filling our gaps, we need all of them. We need PAs. We need MPs. We need doctors. We need all this stuff. That's the gap we're trying to fill here, and this is a start. Think about it. This is an opportunity to stand something up or start the process to stand something up that's going to yield intellectual dividends for generations. Every single one of us has a hospital in our district, or most of us. Especially in the rural ones, getting doctors there is really hard. So PAs are going to be the top line of defense, if you will, or the first person to help administer that rural healthcare in our districts. And so that's what this program does, is help start that process. And so I strongly encourage you to reject Division 1. Thank you.
Chairman Wilson, first time.
Thank you, Mr. Chairman. I don't disagree that PAs are an incredibly valuable part of our healthcare workforce. Nurse practitioners are an incredibly valuable part, and we do have a program for that. But to have us decide, and I appreciate that the bringer of yesterday's amendment has worked long and hard on the issue of PAs. I get that. But if you'll talk to any of your healthcare providers around the state, we have a desperate need for respiratory therapists, for physical therapists, all sorts of other, lab techs, all sorts of professions that train typically out of state, and we have to try to recruit them back. Why are we, from this chamber, picking one category of professional and saying, let's start on that with this $1 million. What if we find out after we do the study that actually we're well loaded with nurse practitioners? I'm not saying that we are, and what we really needed was respiratory therapists and physical therapists. I mean, what if we find that out? Then we've spent $1 million to do this work, and then it turns out that that was the 3rd ranked or the 4th ranked. I just don't think it's wise to launch on a project without actually bringing in workforce services, community colleges, and the university to assess this. I've put a very short reporting date in here, the end of September, to JAC and labor. I'm not asking for a 5-year analysis or something. Workforce Services has got a lot of this. They've got like a 50-page report that we've seen in Labor Committee. I think that it would be far better to really pin it down, come back if next session and maybe, and really go when we know where we're aiming in the right direction.
First time. Anyone else for first time in division number 1? Seeing none. Second time, division number 1 before the divider. Seeing none. Chairman Harshman.
Thank you, Mr. Chairman. Just want to talk about what we're thinking about doing with this division. So the amendment that we adopted yesterday says the appropriations to health sciences purpose of setting up and developing an accredited physician assistant training program. And then when we find out what that is, we'll decide. That's how this works. But right now we continue to talk about it, and then we get stiff-armed and say, oh, you'll have to hire 7 more people. And then I get told, no, over in the state in Utah, they actually sit in the same classes with their medical students that we are currently teaching at our university today. Right? Our WWAMI students do their first 2 years here. And so we think we can do this with very minimal costs. We already have the labs and the facility and the instructors. And then we're talking, we got 200 preceptors out there that help train those WWAMI students. By adding 5 more physician assistants, it's not going to overwhelm that at all. But I think we got to get out there and get started, and then they come back and say, hey, this will work, or no, this won't work. That's what we got to do. But I'll tell you what, somebody who's been here a while, this is how this stuff just keeps going. Let's do another 200,000 for a study. And then you'll have a new group in the department or in the health committee, labor committee next year. After elections, there'll be 20 new representatives on this floor. And then we'll go through this again. Then we'll get a study and nobody will even remember what that study was for. And I think part of this deal, I think we got to move forward. And I think it's just really important. So we got these one-time federal dollars that can be used for this purpose to go out and look at this and what is it going to take really? Come back and tell us. Do we have to hire 7 new faculty at the university? I'll vote no. It'd be cheaper to keep sending them out of state to do it through the WICHE program. But if we can do this, and I think we can do it, I think we can do this. But I think we got to find out. And then the rest of that part, absolutely. I mean, but we didn't study when we set up, nurse practitioners. We didn't do all this study stuff. We set up nursing programs in every community college. And but it's been steps by this body that has initiated that. It wasn't studies by people. It's us who are sent here with that responsibility and that honor to represent our people. So again, I'm passionate about this deal. I think this Division 2 is a winner, but I don't think you win by making other stuff lose. And I think we want a win-win on this deal today and really move our state forward. So I really appreciate your no vote on Division 1. Thank you, Mr. Chairman.
We're on Division 1 of Senate File 66, third reading amendment number 9. All in favor of the division, please say aye. Aye. Opposed, say no. No. Chair is in doubt. All in favor of the division, please stand. Please stay standing. Don't move. Those opposed, please stand. Will be vote close. Okay. The division fails 28-29. We are now on division number 2. Chairman Harshman is the divider. Any comment on division 2?
Vote aye. Thank you, Mr. Chairman.
Chairman Wilson.
Thank you, Mr. Chairman. Yes, vote aye on this one, so we know what we're doing on 95% of the project anyway.
Seeing no further discussion, all those in favor of division 2 on Senate File 66, third reading of amendment number 9. Those in favor say aye. Aye. Opposed say no. Division 2 of amendment number 9 has passed. We're now on third reading amendment number 10 to Senate File 66. Chairman Eklund.
Mr. Chairman, I move third reading amendment number 10 to Senate File 66. I'd ask for your favorable consideration. So we discussed this amendment on second reading, and in my mind, it had some merit. It was, these are projects that have been approved and are partially finished. And because of COVID and inflation costs and what have you, they went up. They don't have the money to finish. Now they can continue to apply for Wyoming Business Council funds. What I did do in it was cut it in half. It gives the project sponsors the surety that they can continue on, and hopefully will get the full funding they need to finish the project.
Representative Worf.
Thank you, Mr. Chairman. I too would urge the body's support for this. As the good presenter mentioned, we have made some adjustments. This was a Second Amendment reading that was narrowly defeated. It does have 10 different projects that represent 8 different counties in the state. And I do think it is important that we stand up and we support these projects that were impacted of nothing that they've done. But anybody that's trying to build something right now knows that the costs have gone up exponentially. I mean, it's been just unbelievable how much more the cost has gone up. So I would encourage the body to do this. I mean, I think when one of our representatives spoke about people that were drowning in the ocean, that's when you save them. And that's what the rescue plan is all about, is saving people that are in trouble. And I do think that this is a wise use of these funds. So I do ask the body to support this amendment. Thank you.
All right, first time, Vice Chairman Larson.
Mr. Chairman, thank you. I would just kind of rehearse what we visited about yesterday. I don't think that there's any question in most everybody's mind that at least a good portion of these cost overruns would qualify for help. We've got a few $1 million in here in this amendment. We have $100 million sitting here already approved that they could go to and use. We've got 50 million in there for water. We have 50 million in there for that local governments can apply for, which most of this funding model went through there. So I would just suggest to you that we have money in there to take care of these. They'll have to go through an application project, just like is outlined in here. It goes through SLIB, just like it does in their amendment. I think we have the mechanism in there to accomplish what is needed and hope that they're successful in that efforts, because we really appreciate what they're trying to get done.
Representative Simpson.
Thank you, Mr. Chairman. Fourth time. I think they're going to be lucky on the fourth try. I appreciate the sponsors for their tenacity. I just wanted to make sure that you're clear. This particular amendment does not affect the $95 million set aside. These are specific line items, so we're not trying to prioritize them in front of other projects. It's just a specific target for these handful of projects that are already, many of them bid out and over budgets. I really appreciated the sponsors for coming in and responding to our request to not pay for the state to pay for all the inflation. They've literally cut these appropriations in half, which means that the local sponsors, whether they be municipalities or private businesses under the Wyoming Business Grant Program, they're going to have to ante up for half of those over budget amounts. And I think this is very reasonable and very fair. I encourage an aye vote for the amendment.
Representative O'Hearn.
Thank you, Mr. Speaker. Like the last representative said, coming up once, coming up twice, coming up 3 times. These projects have already been started. They're in the water. We've already put over $20 million towards them. We can't let them fail. So please get a no vote or aye vote on this amendment. Thank you.
They're in the water, not the wastewater, right? Representative Vice Chairman Ayer.
Thank you, Mr. Speaker. I'd like to rise and urge your support for this amendment as well. If there was ever a definition for a project that qualifies for these ARPA dollars, these projects I think would qualify, would meet that definition. These are projects that have already been started, and to have to go through the application process again, I know there are other dollars that they could go after, other pots of money that they could seek for, but that would entail starting the process over. These are projects that have started. They've been halted because of the epidemic, and they qualify for this funding, and I would urge your support for this amendment.
Representative Knapp.
Thank you, Mr. Chairman. I would recommend a no on this. I think processes and procedures are important. And this was clearly made to go through SLIB. These projects should be a priority as they go to an amended application to SLIB. And I believe that's where they should be funded from. Thank you.
Further discussion, first time. Representative Sherwood.
Thank you, Mr. Chairman. Just a quick reminder, the water projects still flow through SLIB. The remaining projects go through our Economic Development Agency because they are more familiar with them, but they will still be approved. Final approval will still go through SLIB. I believe that this amendment is a compromise that encourages communities to continue to value engineer, to fundraise, to seek alternative pots of funding, and to work with their general contractors to find cost savings. But this is assuring them that when they're ready, we're going to be there. We're going to have our hand up and out for them to pull them out of the water. So this, to me, is a good faith effort in meeting these communities halfway to make sure we close these gaps and get these projects done that are beneficial for our community. Again, we've reduced the ask by half. Just want to remind the body that these projects will generate $6.7 million in revenue recapture back to the state. That's more than we're asking in this amendment. So please help us, help our communities finish what they've started before we start new projects. Thank you.
Anyone else first time? First time, seeing none. Second time, Representative Duncan, first time. Representative Duncan.
Thank you, Mr. Chairman. Any of the projects that WBC do, the majority of these projects, they have to go through SLIB. They have to. And so not to beat this issue to death. They've already been highly vetted. They've already gone through all the processes. They went through SLIB. They got approved, and then they got the rug pulled out from under them. All we're asking is allowing them to finish this project.
Anyone else first time? First time, seeing none again. Second time, Vice Chairman Larson.
Mr. Chairman, I think I'm facing a strong headwind here, but I think it's, nobody's pulled a rug out. Pulling a rug out means is we took, yeah, well, there was just an attempt here, but that means that we took their funding away. That didn't happen. It didn't happen. Now, they had some cost increases that they can't cover, so, and we've put $100 million in here. They don't have to go back through the same application process as been suggested here. In the amendment and in the footnote requires them to do the same process to come before SLIB to see if they can get the funding to finish their project. They don't have to go back through that's going to be defined. Now, we've heard that there's going to be, I would like some clarification, because these dollars here are suggested that we will get revenue, tax revenue, or revenue back to the state in the amount of, did I hear, was it 27? 6.7 million in that we'll get back. So how does that come? Is it in sales tax? Is it in corporate tax? Is it in, so if I could get some clarification on that, that would be helpful. And maybe a little bit of property tax, but there's no corporate tax, there's no state income tax. And the municipal stuff does not generate revenue coming back in. We've got the money in there for the programs. Bless your heart. I think we're all trying to do the same thing. We're just arguing over where it should happen at. I would just clarify and encourage you to vote no on the amendment.
Second time, Representative O'Hearn.
Thank you, Mr. Speaker. The executive downstairs put a rug out there for 10 million, and it did get pulled out. There's 10 different projects throughout the state. Everybody benefits from this. Vote aye.
Representative Wharf, second time.
Thank you, Mr. Chairman. I do appreciate the debate, but I think it can't be lost on the fact that these projects were approved. Some of them had actually been started. Others were in the design process, and it is a restart. And I don't think it's fair to make all these people go back through the system again. These are approved projects. They were approved and recommended by the executive downstairs. This is about half of what he put in his request. I think that it's being very reasonable. It is seeking consensus of this body to say that we're still going to stand with those projects. We've already said we were going to do this. I think we should honor our commitment to these people. Thank you. Please vote aye.
Anyone else for the second time? Representative Sherwood.
Thank you, Mr. Chairman. I just want to address the question about revenue recapture. I believe that 6.7 million is actually quite conservative. So our Economic Development Agency has a formula in which they require communities who have assets that were developed with these funds to provide a percentage back. So if it's a committed business, if it's a for-profit venture, like an airport expansion or a conference center, our Economic Development Agency gets a percentage of revenue recapture from that net. So that 6.7 million is projected by the business, by our Wyoming WBC. This doesn't even capture the secondary economic impacts of, say, increasing tourism to a community or increasing sales tax from the sale when a business who is growing or expanding or coming to our community makes a sale. That 6.7 doesn't even capture the sales tax or the property tax, right? Again, that is a conservative number just on an agreement with these projects and our state economic development organization on the net revenue from this project that will come back to the state. So I hope that provides some clarification.
Second time, Representative Knapp.
Thank you, Mr. Chairman. I akin this to going to a bank for a loan on a business. Now, this body did not approve that loan. The loan was approved through SLIB. So if we took a vote of this body of whether these projects were worthwhile or whether they should continue, I would imagine it would be unanimous that we would do that. But we weren't the bank. The bank is SLIB. So if there's cost overruns, if there's inflation overruns, the lender is the one to go back to for the adjustment. And that's the only thing that I would like to say is it's a matter of process. We appropriate the funds to SLIB. SLIB approves the loans. As the construction happens, if there's any cost overruns, you go back to SLIB for an amendment. SLIB has additional funds this year to do this. And so for me, it's just a matter of process. Thank you.
Anyone else for their second time prior to the sponsor? Seeing none, Chairman Eklund.
So I think everybody has most of the information they need for a vote. I would ask for an aye vote on this amendment. Thank you.
We are on third reading amendment number 10 to Senate File 66. All those in favor, please say aye. Aye. Opposed, say no. No. Chair is in doubt. All those in favor, please stand. All opposed, please rise. Third reading amendment number 10 does not pass. 2629. Let's take a short break for privilege of the floor. Representative Jennings.
Thank you, Mr. Chairman. Members, if you'd stand and welcome, all the way down from, used to be Sheridan County, but they moved to Johnson County, so we're handing them off to new Representative Angel Brinkenhoff. If you guys would stand, and our three lovely children, London, Paisley, and Ryder.
Welcome to the House. We are now on Senate File 66, third reading amendment number 11. Chairman Olson.
Thank you, Mr. Chairman. I bring you third reading amendment number 11 to Senate File 66. I do move this amendment and ask for your favorable consideration. I feel like at some point we determined that a small amount might mean 5 million or 15 million. But so then this amendment must be a baby ask, which is what it is. Ladies and gentlemen, we are asking for $250,000, which is on a 4-to-1 match with the state to fill the gap of a cost for construction of projects for children's museums that also serve as community multipurpose facilities as determined by the governor. In the capital city, the museum, the Children's Museum was negatively impacted by the public health emergency in their construction costs. As you can imagine, everyone is experiencing those construction costs. Specifically, it's a steel cost. And the gap between what has been raised and construction beginning this spring and hopefully culminating in just the next couple of years is a very moderate amount, about $700,000. So this 4-to-1 match, again, it's a 4-to-1 state match for just $250,000. Will close the gap on those steel costs, move this project forward, which will be the only project like it in the entire state of Wyoming, honestly. And hopefully that means not just communities such as in the capital city stop commuting south of the border, but it also means that communities around Wyoming have a place to go to bring their children and keep those dollars inside the state of Wyoming. Just a little bit more information. The CMC's exhibit selection, if you haven't had a chance to really dive into that and understand it, it incorporates the stream components of science, technology, reading, relationships, engineering, arts, and math in an innovative design. So I'm really excited for the economic impacts that a museum like this will have for the community, for young professionals, for growing families. When you're trying to determine where to live and start your career. Certainly, if you have children, it is a major, major factor in determining whether you stay in a community. And as we know, we export better than anything else our talent, unfortunately, in Wyoming. So just anything else we can do to continue to keep our folks here in Wyoming, and this is one of them. So urge your aye vote. Thank you, Mr. Chairman.
Representative Gray.
Thank you, Mr. Chairman. I'd just like to confirm that this is for the Cheyenne Museum because the amendment is drafted in a more broad manner. And if the answer is that it is for other museums, I would like someone to list off what communities those are in. So thank you.
Representative Vice Chairman Henderson.
Thank you, Mr. Chairman. I stand in support of this because our children, and we just had one introduced to us, and I love it when they come here and they get introduced, because these are our future. As the gentleman who brought the amendment said, this is for children all over our state. And I've been hearing this over and over again over the years that we need to do more to help keep our children here in Wyoming. And what better way for them to learn about the history of our great state and the communities across our state? So I strongly urge your support. It's 4-1. 4-1. That's 4 times the money for $1.
Vice Chairman Newsom.
Thank you, Mr. Chairman, or thank you, Mr. Chairman. My question is where, I'm assuming the 250 is not the total project cost, and there's a match, of course. Relieved that it's not coming out of tourism, but I'm wondering where the other funds are coming from.
Anyone else for their first time? First time Vice Chairman Duncan.
Thank you, Mr. Chairman. I would urge an aye vote. This is a great idea. Think about all the different types of education that we have around our state. So we have virtual schools, we have homeschoolers, we have all different kinds that would be able to utilize this, not to mention the, some of us adults being able to take people different places. But there's a lot of times that we go all the way down to the state to the south of us, and to have that opportunity to be here locally instead of having to go to multiple states around. So I think we could utilize this for a lot of different opportunities and education. Our kids who come here to the Capitol, maybe they could utilize this in one of their trips as well.
Representative Banks.
Thank you, Mr. Chairman. To follow up on the question from the representative from House District 57, just if you would clarify, is it just for the Capital City Museum? For instance, we have a children's museum in my community. Could they also apply for grants through this program? Or could other communities apply? How does that work? Thank you.
Anyone else for their first time? First time Representative Stith? No one else for the first time? Okay, second time before the sponsor. Anyone else for their second time? Representative Gray. For your second time.
Thank you, Mr. Chairman. I'm just concerned about the way it is worded. It says that it's a children's museum that is also deemed to be a multi-purpose facility by the governor. I mean, it sounds like it's almost drafted in a way for it to be a presupposed thing that it's going to be a Cheyenne deal. And so, I mean, if we're going to have this sort of program, I think it should be equitable and there should be multiple communities applying into it. So I'd urge a no. Thank you.
Anyone else for the second time? Seeing none, second time back to the sponsor, Chairman Olson.
Thank you, Mr. Chairman. Just to address some of those questions, yes, in fact, it definitely does not come out of tourism, so I think we can all be excited about that. We were talking about the ARPA dollars. It does fall under page 4,379 of the bill, which deals specifically with nonprofits, and it deals with loans, grants, and in-kind assistance and technical assistance to those nonprofits. So I would answer in the affirmative that it would be available for those other nonprofits. With respect to the community that the funds are most likely to be directed towards, I guess I see it differently. I don't see that when we make an appropriation or an allocation of money to the university over the hill, that it is only going to that community. That is a beneficial interest to the entire state of Wyoming. I don't see that any different for a facility in the capital city of our great state. And like I said, we export interest in this corner of the state into the state to the south of us. And I believe that it will attract not only individuals in the community of the capital city to enjoy this facility, but I think that would occur across the state as a whole. And to the last question on the amount of funds, this is certainly not all of the project. No, the project is into the millions. The project has privately raised $2.5 million. The cost of steel, very specifically, has caused a $700,000 project gap. And we're talking about a 4-to-1 match, which closes that gap and keeps this project moving along, which has been a project underway since 2014. So community long overdue for this, and frankly, the state of Wyoming really just long overdue for something of this magnitude. So urgent and I vote, and thank you, Mr. Chairman.
We are on third reading amendment number 11 to Senate File 66. All those in favor, please say aye. Opposed, say no. Third reading amendment number 11 has passed. Division being called. All in favor of the amendment, please arise. Third reading amendment number 11 has passed. 38 aye votes. Mr. Majority Floor Leader.
Mr. Chairman, I know there's a few more amendments coming, and I think the best thing to do now is just to kind of go to lunch. So, Mr. Chairman, I move the House stand in recess until 2 p.m.
You've heard the motion. All those in favor, please say aye. Opposed, say no. Motion passes. Any committee announcements? Chairman Nicholas.
Thank you. Ladies and gentlemen, your House appropriations will meet 10 minutes after noon recess to hear Senate File 73, 112, 106, 90, and Senate File 8 and any other re-referrals. Your joint conference committee will meet between 3 and 4, depending on when we get through the rest of the budgets.
Chairman Flitner, speak loud.
Mr. Chairman, thank you. Your committee number 6, Travel, Recreation, Wildlife, and Cultural Resources, will meet in 15 minutes. We will discuss or work Senate File 61. We'll finish that discussion or finish that bill, and then we'll move on to Senate File 86, Senate File 11, room E005.
Chairman Burkhart.
Thank you, Mr. Chairman. Your committee number 8, Transportation, will meet in about 15 minutes to discuss Senate File 41, expanding X Generation 911, and Senate File 92, engrossed, driver's license renewal or extension exception.
Seeing no other committee announcements, we are recessed until 2 o'clock.